last, may I introduce Stephanie Nakajima, who is going to speak about the fight for reproductive rights and Medicare for all. Please welcome Stephanie Nakajima.
Hello, hello. All right, I've been told to keep this quick. So, under our horrible capitalist healthcare system, even wealthy people can get tremendous bills. I think that one thing we highlight as single-payer advocates, though, is that those who truly suffer. Oh, sorry. Am I talking? Can you hear me now? Okay. Sorry. So those who truly suffer because in our healthcare system, because they have terrible coverage or none at all, are disproportionately always low income or disproportionately people of color. When it comes to abortion, this disparity is amplified. 75% of all women and non-men seeking an abortion are low income, and people of color are... Oh, sorry. Is this better? I'm not sure. Okay. Okay. It sounds really loud now. Okay. And when it comes to coverage, only half of women have abortion coverage. I can't think of any other medical procedure so routine, so fundamentally important to bodily autonomy, where the percentage of patients paying out of pocket and the percentage of patients who don't have any coverage at all that covers abortion is so uncertain. So one huge advantage of the Medicare for All bill is that it could potentially radically rectify this issue. Medicare for All could guarantee every woman and non-man in this country an abortion free at the point of service whenever they would need one in their lives. So that's great. However, many of us in the single-payer movement have a tendency to shy away from abortion. There's a temptation to kick the can down the road, say we'll get to that fight, when we get there, and try not to mention it in fear of the opposition it can generate and people who would otherwise be sympathetic to single payer. It's seen as sort of a wedge issue. From where I stand, I think we need to do the exact opposite. We need to fight the stigma of taxpayer-funded abortion just as fiercely as we fight the stigma of government insurance. And the truth is, we need to do this for two reasons. The first reason is a practical, strategic reason. The truth is that we aren't getting an unapologetic national payer healthcare plan without unapologetic reproductive justice. Right now, half of people have abortion coverage, actually, through their private insurance or through like a state Medicaid plan. This isn't great, obviously. Everyone should have abortion coverage. And most of the people who are left out, as I mentioned before, are left out because of the Hyde Amendment, which prohibits federal funds from being used for abortion. But if we pass a single payer and then at the end game, all of a sudden abortion gets knocked out, well, that means that all of a sudden 50% of people who had abortion coverage through their private insurance plan no longer have that coverage. And in fact, nobody will have abortion coverage at all. Abortion rights activists, they have concerns about Medicare for All, and some of them are a little bit bad faith, but this is not one of them. This is a really big issue. And so I think that if you think that we're going to fight that battle when we get there, and that we're just going to cite reproductive justice or whatever right now, I don't think that's going to happen. Secondly, people who need and seek an abortion right now suffer. They suffer financially, but they also suffer the isolation of having an abortion, especially in the United States. I myself have had 2 abortions. I had one in the United States, and I had one in Copenhagen, Denmark. And if I had to boil down my experience, I don't really have time to talk about it thoroughly now, but if I had boiled down my experience into one sentence, in Copenhagen, I had my abortion at a regular doctor's office. It was a routine visit. It was covered 100% by the National Health Insurance Plan as the part of the regular catalog of services. I didn't pay a dime. In the US, I went to a special unmarked clinic where they had mad security and a metal detector. And I had to pay for the expensive procedure out of pocket and had to do all of that in the face of protesters who were at every point trying to get me to turn back. So my first experience was, affirming my right to have an abortion. And the other was telling me I had something to hide, that I was doing something shameful. Obviously, it's going to take some time to make this cultural shift, but if we work for it, we can make this country a better place for women and non-men who are seeking an abortion. I feel like I need to skip ahead because we're running out of time. So one other thing I want to say is that we have to stop acting like taxpayer-funded abortion is taboo. In other high-income countries, France, Denmark, Italy, extremely Catholic country, Ireland, they fully fund abortion for all of their residents. There's 100% global, 100% normal. And globally, we are actually the regressive outlier on abortion, just like we're the regressive outlier on healthcare. So one concrete way that we can come out strong for abortion is to make sure that the word abortion is in all of our healthcare bills. So HR 1384 came a really long way in supporting reproductive services by nullifying the Hyde Amendment, which, as I mentioned, prohibits federal funds from paying for abortion. So HR 1384 says the Hyde Amendment does not apply to this legislation. But the word abortion is still not used in the bill. The bill only references reproductive services. And some of the public option bills, they also nullify Hyde, but they go a step further by actually explicitly including the word abortion as a listed service. So how many people here think that it's time for us to have the word abortion in the bill HR 1384? Yes. That's what I wanted to hear. So we can't capitulate to the anti-choice voice here. We have to come out strong. We have to fight the stigma. And that's how we're going to keep our promise to create a fairer and more equitable country for everybody. Thank you.
Thank you so much.